This session is the 10 unhelpful myths revisited about the Canada Health Act. And I am so pleased. I'm Elizabeth Kwan. I'm from the Canadian Labour Congress. I am so pleased to be the moderator, although I don't know why they need me, but the moderator for this panel. Two very distinguished and accomplished scholars, authors, thought leaders in the field of health policy. So to my immediate right is Greg Marchildon, who, amongst many things, was the executive director and lead drafter of the Commission on the Future of Healthcare in Canada, or more lovingly and commonly known as the Romanoff Commission. And next to Greg is Bill Tholl, who is the one of the key drafters of the Canada Health Act under then Minister Monique Bégin. So we've got two people with very deep knowledge that they can share about this. And please read their biographies in your booklet. And I will waste no more time because they have much to say. And I hope that after their comments that there'll be many questions. Take it away, Greg. Oh, Bill.
Okay.
Bill. Okay.
Yeah, I'll start off. Thanks very much, Elizabeth. And thanks to the Canadian Health Coalition for co-hosting with the University of Ottawa this extraordinary event. We don't celebrate our successes nearly often enough in this country. So having an opportunity to sit back and reflect on the Canada Health Act is exactly the right thing to do. In terms of the session before, Greg and I have no conflicts of interest to declare, but we do have a whole bunch of baggage to declare, which will become clearer. Third, really appreciate all the good work that the Canada CHA division is doing for us day in and day out. And yes, Jen, the CHA does have some life left in it. We're here to find a way to breathe new life into it, right? And so one way to do that is to talk about a Canada Health Act 2.0. And that's kind of where we're going to land today. And with 15 minutes, right, Elizabeth, that's just enough time to get ourselves into trouble and not enough time to get ourselves back out of trouble. So Greg and I just learned yesterday that we have an op-ed piece that we've submitted to the IRP policy options, which will detail it, provide more detail in what we mean when we talk about a CHA 2.0. So next slide, Bill. So I've had the pleasure of actually meeting, I'm that old, all three of these folks. Tommy Douglas, some of you might remember the 1979 SOS Medicare conference that gave birth to the Canadian Health Coalition. Hey, Michael Reckless, there we go. Anybody else in the room that was there? Oh, there's a few, yeah. The second one, Justice Emmett Hall, his second coming. You know, when Madame Bégin was out of the ministry, a shadow cabinet critic in 1979, created all this fuss. David Crombie invited Justice Hall to come out of retirement, Hall 2.0. One of my jobs at Health and Welfare Canada back then, not just Health Canada, was to follow him around and take notes and report it back to the center. What was he coming up with in terms of extra billing, user fees, and the whole big issue around diversion of funds, which of course he concluded he couldn't prove. Nobody could prove because the monies are all green, is what he used to say. And of course, I had the pleasure of working with Madame Bégin in 1984. The mother of Medicare. I was really pleased to see in the CHA most recent report a nice tribute to Madame Bégin, quite appropriate. And if for those of you who've read Jane Philpott's book, she has an epilogue at the end, again, paying appropriate tribute to a person that I call a minister for health, not just a minister of health. And of course, when you confronted her with this legacy, she would say, I was just doing my job, right? So we've heard a number of concerns raised literally from the coalface or from the local communities here today. I mean, Riverside Hospital and so forth. There's a survey that came out last February 2023 by Angus Reid Institute that caused me a lot of concern, among other reasons, because it didn't get a whole lot of attention back then. So this survey actually took us, it's 2,000 plus, so it's a representative sample of Canadians. And it concluded that the Canadians had three mindsets when it came to Canada Health Act Medicare. One was the purists, and I suspect we got a bunch of purists in this room, that the Canada Health Act came down from on high, Mount Sinai, like, and Madame Bejan was the equivalent of sort of Moses, and that every word in that, 13 pages was carefully crafted. Let me remind you, it was all done between October 1983 and April 17th, 1984, in the short space of 5 months. So we got what we hope was most of it right. But to suggest that every word was come from on high, it wasn't my experience. So 39, good news is 39, I can't read that, but I think it's 39% of Canadians said, we really, really want to, we think CHA is defining who we are as Canadians, and it's a fundamental right of being a resident of Canada. The second third, if you will, are what Angus Reid calls the pragmatists. The health system isn't work. It's based, we support the basic principles of Medicare, the 5 criteria, but it's not working for us. So can we be pragmatic about looking at how private sector can help the public sector provide where it's not providing now? The third one, the 28%, is the worrisome one. Those are the pragmatists, or pragmatists in the sense of promoting private sector solutions. I'm giving up on the healthcare system as we know it. I'm giving up on Medicare and this whole idea of prepaid universal health insurance. And by the way, 50% of those have indicated, when asked, how do you intend to vote in the next federal election? 50% said the Conservative Party of Canada. That's the first time. Greg and I have been around a long time, lots of baggage. That's the first time we've seen any number approaching 28% of Canadians giving up on Medicare as we know it. So there's a real kind of opportunity here to fill this, to address these issues. So the first thing to tell you is that we're not going to talk about the top 10 myths. We did publish a piece, 2 minutes. We did publish a piece in 2017 in Canada Health Law, was it, Greg? Health Law Canada. Please take a look. We're only going to focus on 3 here, and just to prime the pump. The 3 myths that we want to address today are: CHA is responsible for the current access and waiting time problems in Canada. False. As you've heard, it's the provinces and the territories that have the primary responsibility for the administration and delivery and governance of health and healthcare. What we do know is that primary healthcare reform is essential. Whether you look at the Commonwealth health studies that show that successful healthcare systems get the primary care door, front door right, or whether you look at Jane Philpott's book, if you've had a chance to read it. Primary care is one way to move up that ladder from the 10th out of 11 to something only surpassed by the United States that exists to make us look good when it comes to this kind of stuff. Move us up from 10 out of 11. Second one, CHA has frozen out innovation. False. But the Canada Health Act does is provide a floor, not a ceiling. It doesn't limit what provinces can do. And you heard today that many provinces go well beyond the ambit of the act. But question, is it time to raise that floor? Given the 40 years of experience with innovation and everything else, we contend it is. There's practitioners, pharmacists doing what doctors used to do. People who know the act know that it's not bound by facilities. It's any facility or portion thereof. 1 minute, yeah. Down to the third point, last point. Canada Health Act cannot be amended without opening up a Pandora's box to privatization. What I can tell you, in 1984, there were the same concerns about passing the Canada Health Act back then and undercutting the original HIDS Act and Medical Care Act of 1966. What it took was political leadership from a minister for health and a willing prime minister who had already announced that he was packing it in. He wasn't going to run for re-election in September of 1984. What it takes is political will. There are precedents, maybe not consequential precedents with the RCMP, but it went through on page, 386 in the omnibus bill, where you get all party support, you can ram these things through. That's within my 7.5 minutes. Thank you.
Okay. So go ahead, Greg.
Okay,
Thank you,
thanks a
Bill.
lot. And I'm going to try to stick to time because I work so hard to get Bill to stick to his time. There is a window of opportunity And we have a little slide here on it, but this window of opportunity, we think it could be, anywhere between 12 and 18 months, but it's actually likely to be less than 12 months. And time is ticking right now. And there are two fronts that we need to move on immediately. One of them is the provincial front. As we said, I mean, it's mainly our provincial and territorial governments. So wherever we're resident in this country, that's who we have to look to first, particularly the provincial and territorial ministers of health. And we need to put pressure on them as citizens and as members of civil society groups to address the access, quality, and timeliness of care problems that are driving the kind of dissatisfaction that Bill just talked about. The second front is the Government of Canada, and that is to lobby the Liberal government and the NDP, which supports key bills, to draft, introduce, and pass into law the CHA 2.0. And what do we mean by the CHA, the Canada Health Act 2.0? We're talking about updating, clarifying, strengthening. And here we only have time to give a few examples of this. There are many possibilities, but here are a few. One of them is to strengthen portability in Canada, and really to keep with the spirit of the original Canada Health Act, to ensure that everyone in the country, wherever they're traveling in the country, that they have access without financial barriers to healthcare, and that portability is defined in that way. Portability is, after all, the glue that holds this pan-Canadian health system together. Without it, well, we don't have it. The second thing is to change the definition of insured health services to include all primary care providers. Just be very clear, this is for primary care providers, including, of course, nurse practitioners, is the problem in Ontario that's developed in a few other jurisdictions in this country. And connected to this is to make sure that it includes virtual care. This may require some definition of what's meant by medically required and medically necessary, to make sure it includes, of course, virtual care services, whether primary care or specialist type services. The next area or example would be to, in fact, provide investigative powers in terms of the team that responsible for the enforcement of the Canada Health Act, but in this case, perhaps through an arm's length agency. In other words, the creation of an arm's length agency. I can't get into much detail right now, but we live in a country where there is likely to be a lot of pushback from one jurisdiction concerning that. And so we need to look at something that might be a bit more of an innovative solution, in which you have an agency for all of Canada except for Quebec, but Quebec has its own arm's length investigative agency, but it has to be as transparent as the other agency with information flow, et cetera. So that's one possibility. Finally, I think is absolutely critical at this time, as we heard in the last session, to be clear that the Canada Health Act 2.0 is an on-ramp for Denticare and Pharmacare, for these to become universal services. This will force both the Liberals and the NDP to reveal their timelines, to turn what are now targeted services and very partial services into universal services. This will force the Liberals, if they're re-elected, it'll prevent them from going back and doing as little as possible. It's no secret that the Liberal government was never keen on pharmacare, never keen. It never wanted to do it. It was, in a sense, pushed to do it. But if it ever achieved a majority government, it would probably go back to that stance again very quickly. In terms of the NDP, this would communicate very clearly to the NDP by us that targeted partial programs are not an extension of Medicare. This is not universal Medicare. It might become, but you better be clear on how it becomes universal. In terms of the Conservative Party of Canada, it forces the Conservative Party of Canada to state its position for or against. It can't hide or avoid, in this case, and wait until after the election to announce what it wants to do. It can either support the Canada Health Act 2.0, that will make it extremely difficult for it to reverse its position after it's elected, if it is elected. And if it's against, it is then forced by the media and civil society basically to explain why and what its intentions are in terms of the Canada Health Act well before the election. Now, I know that some of you fear opening up, and we can talk about that in the question period, but the real point here is that after the election is too late. The window will be closed, and time is ticking, and we can't afford any longer not to be proactive. Thank you.
Okay, I have to say, great admiration for the ability to just summarize all of that information in 15 minutes to both of you. Thank you so much. At this point, I'm going to welcome questions because this is really for you. And, you know, you have two great panelists here who can, you know, share some thoughts on the questions you raised. So I invite anyone to go up to the mic and ask away. And can you direct either to both or whoever you're directing your question to, please? Dan, go ahead.
Can you guys hear me? Perfect. It's a question for both. Bill, you mentioned that some of the preconditions that were in place in the 80s when you worked on the Canada Health Act was a minister for health and a prime minister who had made the decision that they weren't going to run again. I don't think that's what we have right now. We don't have a minister for health, and we don't have a prime minister who's decided that this is their last election. Perhaps they will, but we don't know. And I'm also concerned that, you know, the opposition leader is very smart and tactical, and the government tried to force him in a corner with the capital gains reforms, and he kind of spun that around and turned it into this job killing, that, you know, the rhetoric he's using is this job killing capital gains tax, which of course is you know, disingenuous. So while I agree that we need to add the enforcement element, we need to redefine medically insured services, my disagreement is with none of the propositions. My questions are from like a political strategy perspective. I don't see the preconditions for something like this to be successful, and at a time when so many of us are trying to pick our battles. Why should we put this on the top of our policy agenda as opposed to, for example, taking pharmacare across the line? And I offer this as a friend and ally trying to figure out, between now and the election, we all have so many hours. Why should we spend our time on this versus something else?
Let me take an initial cut. Thanks for the question. So I'll start with the last point first. In Jane Philpott's book, she talks about sister legislation. You heard about sister legislation this morning. My concern around sister legislation is it's orphan legislation. It's just hanging out there like a piñata. What was it, $1.4 billion preliminarily allocated to pharmacare just to get it started? Well, fast forward, fall of 2025, big red X over pharmacare, save $1.4 billion. If it's safely tucked away with consequential amendments to the Canada Health Act, it becomes a lot more difficult to kind of just put a big red X over it. So that's I think the answer to the last question. Second one, I must say, do you want to telecast the strategy to Pierre Poilievre now? Because you're right, the Liberals gave him 3 months' notice. I'm going to make this a separate bill, and you get a chance to figure out whether you want to vote for it or against it. Do you want to vote for tax cuts, or do you don't? I'm reluctant to. We were reluctant to actually put the idea on the table today for fear that he might get, have all that time to plan or to dying days. Yes, there were dying days for the Liberal government back in '84. I would argue there's dying days now. Desperation hockey gets desperation moves. This is sorry for the metaphor on hockey, but the whole idea here is it's it's the third period. You got your goalie pulled. What are the odds of getting reelected unless you create a wedge issue that the Liberals own, which is Medicare? And the alternative, you had to spring, where is it here? You had to spring forward in the spring, i.e. introduce in the fall, as part of a speech from the throne, a commitment to CHA 2.0, right? Give the minister, and I think Minister Holland, by the way, could become a minister for health. He was with the Heart and Stroke Foundation of Ontario when I was CEO of the Heart and Stroke Foundation of Canada. So I think he could step up to the plate, but he needs a permission slip from the Prime Minister. That is to say, a mandate letter from the Prime Minister in the fall, so that by the spring we can spring forward. Otherwise, by the fall of 2025, we will fall back.
I'll quickly just say that, of course, somebody like Pierre Poilievre would say that, wouldn't he, in terms of avoiding the issue? And he will continue to avoid it until absolutely forced to deal with it. This would force him to deal with it. Nothing short of this would likely force him to deal with it. And he'll try to be smart, but of course, he'll ultimately have to make a decision, and there are forces within his own party that are going to force him to make a decision on this. In terms of the connection, I think Medicare or the Canada Health Act 2.0 is taking pharmacare across the line. What's going on now is not taking it across the line. And I fear that this is just going to die. It might die before the election. And if it doesn't die before the election, if a new government's elected and it happens to be led by Pierre Poilievre, it will certainly die then. So this is desperate time. And I think this is needed to help carry pharmacare over the line. Maybe I'm wrong, but I think it's very connected to it.
Thank you both. Tyler?
Thanks to both of you for your presentations. Very insightful stuff. Yeah, I just wanted to play devil's advocate a bit more and just, think about the political will part of the equation here, and that given the NDP was able to kind of negotiate what they were able to negotiate, and the agreement with the Liberals, which was not satisfactory at all on pharmacare. It's just hard to imagine a scenario where they'd be able to leverage their position to push them significantly further around something like this. So just thinking about what we've heard today so far, for example, the interpretation letter, information that we got first off the bat this morning, and seemed to create a certain legal precedent with the Canby case and make a difference. We are expecting another interpretation letter that's going to cover some of the points you mentioned, Bill. Is it worthwhile, perhaps, trying to just focus our lobbying efforts on ensuring that's as strong as it can be and not deal with the potential negative consequences of reopening the Canada Health Act? So just any thoughts that you may have about the political will reality of, the moment that we're in with the Liberal NDP agreement, and if we can perhaps look to the interpretation letter as at least partially addressing that issue, not the pharmacare issue, of course.
Yeah, I think that what you're describing is sort of more incrementalism. And an interpretation letter is not the same as an amendment. It's at best a stopgap. And if you think that will be sufficient, then it's probably the right strategy. I happen to think it's not sufficient, and it's self-defeating. And I think that for both parties, the Liberals and the NDP, to go to an election in the next few months would be a disaster for both. They need each other right now. They need the time. They need an issue. And I think this could potentially be at least one major issue that they could run the election on. Otherwise, they're playing defense instead of playing offense, instead of forcing Pierre Poilievre and others basically to reveal their hands. So I do think that an incremental strategy is going to be self-defeating. The other part of it is I'm not sure I can trust either the Liberals or the NDP to deliver universal pharmacare, even if they happen to, let's say the Liberals are reelected in a minority situation with NDP support. I don't know how much you can trust that to deliver universal pharmacare in the next 3 years. I don't feel very confident about it.
Bill?
Just to add a couple of points, interpretation letters necessary, but not sufficient. I do think that they help prevent backsliding. And they build one upon the other. There's three, there'll be a fourth. So they're necessary, but they really don't prevent longer term backsliding. Point one. Point two, the key term that was used back in the Canada Health Act days was safeguarding. The idea that you take a step forward and then you prevent the brake from slipping to go backwards, right? So safeguarding was a critical term. I see a similar challenge now in terms of safeguarding the gains that we've made over the years in the interpretation of the Canada Health and all the good background work that you guys have been doing. Third and last, I guess, I've already received word from some of the people within the Liberal Party that they're interested in talking more about CHA 2.0. So we'll see where that takes us. But again, I'll just repeat, desperate people do desperate things. And right now I don't know, I haven't been following the polls, they're 24 points behind. As I say, the goalkeepers may be pulled. It's time to kind of put another person on the ice. The last thing, I'm going to share a secret with you. The Canada Health Act in the original version was written literally on a napkin at Whispers restaurant. And it was with two of us within government, because it has to involve government, but it was with a half a dozen people from outside government that we were looking for support from. And you don't have to go very far to figure out who they would be. The CFNU, the Canadian Nurses Association, back then the Canadian you guys are the Canadian Health Coalition. There was another group there. Consumers Association of Canada, because those are the only ones that were in favor of the Canada Health Act. Every province in the country except Manitoba was against it. Came at second reading. Every one of them except Larry Desjardins from NDP, right, in Manitoba. And of course, the Doctors of Canada, the Canadian Medical Association was offside as well. I challenge the CMA right now. Can we be on the right side this time for the CHA as opposed to the offside? For those of you who don't know, I was CEO of the CMA for 8 years, so I can say that.
Greg?
Yeah, just a quick question. You maybe answered some of it, Bill. I was just wondering, in your conversations with the Liberals and the NDP, really, is there an appetite for this?
Well, there's certainly an appetite locally to deal with the nurse practitioner issue. There's some folks here in town who want to get reelected and are trying to position themselves, get out in front of whatever interpretation letter there might be that makes them look good in their backyard. Federally, it's PMO, not PCO, that's been kind of looking at maybe convening a meeting, but we'll see where that takes us.
Yeah.
Not yet.
Well, let me say that there's some political appetite. I wish, but I have to say, there's no policy appetite. And that bothers me immensely. I guess I maybe disagree about something that was said earlier. Even if it's not done for the right reasons, I'd take it being done, period, and worry about the motives later.
Okay. Oh,
One quick one. If I may.
Yeah, quick question, not necessarily a quick answer.
Just to throw in the mix, the state of our provincial ministries of health in terms of the public service is not at a good place. So I just urge caution, I guess, and maybe just to echo Dan's comments, I just don't know where it leads us in terms of if so much is coming down to what's happening within the provinces, where does that leave us?
If the premise of your question is that there's been a hollowing out of the policy capacity provincially and
commitment to the Canada Health Act.
well,
Yeah.
as a recovering sort of bureaucrat, I would say, yes, I do see an almost one hand clapping kind of thing. But that's not, that's the answer to that is not to give up. The answer to that is for somebody just to pick up the pen and start looking, what would a new Canada Health Act, new and emboldened, one for the 2024, for the 21st century look like? And take that 13 pages and look at, where can it be strengthened to reflect the last 40 years and to lock in the interpretation letters maybe. But I don't, and that would have to be done with with the bureaucracy rather than kind of surprising them. But that's why I mentioned the napkin and sitting down with people outside to see what that might look like and where we might look forward to getting support for the Canada Health in the first place.
And always remember, CHA 2.0 is one front. The other front is to continue to put as much pressure as possible on your respective provincial and territorial governments and the ministers of health to start addressing some of the access, quality, and timeliness issues and to ensure that we don't continue to be going down a road where the system is worsening and worsening. And we're facing two problems. I think one is this hollowing out that we've talked about, and therefore mistakes are being made over and over. And the second issue is that the systems themselves are problematic, and that's a long-term issue that needs to be addressed. And it won't necessarily be addressed immediately, but we got to plant the seed so it begins to be addressed over time by the right ministers of health. Doesn't have to be addressed across the country immediately. It can't be, it won't be, but in one or two provinces that can act as a model for the rest of the country. And that's one of the advantages of living in a decentralized federation. When something goes right, everybody notices and they copy.
thank you both very much, Bill, Greg. I invite you all to help me thank the two great panelists and their thoughts. Thank you.